Hey everyone, hey, welcome back to Amize Health, your journey to amazing health. I'm Dr. Thorpe Amize. Thank you so much for joining me today. So, today's discussion basically surrounds upper respiratory infections. And for some people, that may be a big word to use, or maybe you haven't heard that term before. But upper respiratory infections is basically referring to respiratory infections that does not involve the lungs. So anything basically from here up is what we're discussing. So we're talking about the common cold, we're talking about sinus infections, we're talking about basically infections of the throat, those kind of infections. So common upper respiratory infections. And most common upper respiratory infections are caused by viruses, not bacteria. And so sometimes people come into the office and they automatically want an antibiotic, but really what's causing their symptoms are really a virus, and therefore an antibiotic is not necessary. So sometimes people get antibiotics from other providers, and they feel like, oh well, it worked the last time. Well, really it would have it's not necessarily that the antibiotic worked, it's just that the virus ran its course. And so whether you had that antibiotic on board or not, the virus would have run its course anyway. So again, thank you for joining me. What we're not discussing tonight is lower respiratory infections. So things that get down into the lungs, such as bronchitis. And that's another one that we commonly get complaints for is, oh, well, I think I have bronchitis, but really most of the symptoms are nasal congestion, runny nose, coughing. That's an upper respiratory infection. And so those are the things that we're talking about tonight. So once again, thank you for joining me as we discuss upper respiratory infections. And usually I like to go through the things that I talked about in the past 3 weeks so that in bringing that up, that may spark any questions that you guys may have so that I can appropriately answer it. So one of the things that we talked about the last in basically in the first week of this month was some tips to avoid getting sick. So basically common preventative measures, and some of them you guys already know about, just like I said before, which is making sure that you're using hand hygiene, meaning wash your hands, use hand sanitizer. You don't know what surfaces someone that may have one of these infections may have touched, and now you touch that surface and rub your nose or rub your eyes or your face, and now you transferred that virus to yourself. So washing your hands frequently, especially during this season, is really something that we need to get used to doing. Covering your mouth if you're coughing or sneezing, and better yet, wear a mask, right? If you know you're having some symptoms, wear a mask. Wearing a mask has been shown to be effective really for minimizing the spread of COVID. COVID is just another type of virus. So, just like the upper respiratory viruses, which is like a family of viruses, you can minimize the spread by wearing a mask, because if you are coughing or sneezing, you are there's millions of those particles coming out your nose or mouth at the time, and that can spread to other individuals. So protect yourself from others illnesses by wearing a mask, and if you have an illness, you can protect others by wearing a mask also. So basically hand hygiene, face coverings like masks. And then one of the herbal products, and I wasn't going to talk too much about herbal products because that's just not my area of expertise, and there's not a lot of studies that's been done on a lot of the different herbal products that people like to use. But one of the herbal products that has been shown to have some minimal effects is euthanasia. So that's one of the things that you can potentially use. And a lot of people like to use a lot of vitamin C to prevent, kind of ward off illness. That's something to do. But once you have gotten sick, once you're sick already, that vitamin C is not as helpful as it was before. So using it for prevention is definitely great. Okay, so I'm going to pause for a second, see if anyone have any questions. Thank you for joining me on this YouTube live, but I am also on TikTok, Instagram, Facebook. under the same name, Amaze Health. So if you want to send me a message because you cannot send one on YouTube Live, send me a question there and I'll be checking periodically so that I can answer all your questions. So those were all the tips to avoid getting sick. So those are our preventative measures that we talked about: covering your mouth, using hand sanitizer, washing your hands, wearing a mask if you need to. So in week 2, I went into some common home remedies that worked. So we already just mentioned euthanasia, but raw honey is one of the things that has been studied quite well. And I did mention making sure that when I say raw honey, it's actually raw honey. Sometimes when you go into the supermarket, something is marked as honey, but it doesn't say raw honey, and it turns out that it's just a lot of high fructose corn syrup. Well, that's not going to do the job for you. What you need to do is get some raw honey, a teaspoon of raw honey every 4 to 6 hours. That will definitely help the coughing. And it's been proven for use in children, but not, and in adults actually. So raw honey is one. Then if you have like sinus congestion, one of the things that we typically recommend is flushing out that mucus with like a nasal rinse. Using a nasal rinse to flush the mucus can be quite helpful. Now, the studies don't seem to have like a definitive conclusion on using a humidifier, but really using a humidifier especially in these winter months when the air is a lot drier, can be helpful, because a lot of people, when they get these upper respiratory infections, they're getting a lot of nasal congestion or a lot of runny nose. And when that happens and you go to sleep and you go to sleep in this dry air, that dries all the mucus up in your nares. And when you wake up in the morning, it's hard to breathe, it's hard to get it out, it's all dry and stuck in there. And so one of the things that we typically recommend for that is using like a nasal saline to soften that up so you can get it out easily, because oftentimes, especially our young ones, will go in their nose picking it out, and what happens? They end up with a nosebleed. So in order to try to avoid that, use a humidifier wherever they're sleeping at night. If you either don't have a humidifier or you're able to do like a steamy shower, stay in that steamy shower for about 15 minutes to help to bring some of that mucus down. That can be quite helpful also. So these are the things that we are talking about that actually has quite a bit of benefit. Now, if you have a fever, using an analgesic like Tylenol or ibuprofen can prove to be helpful. And then a lot of the over-the-counter medicines don't necessarily work. Um, Over-the-counter antihistamines can be helpful when used in combination with a decongestion or a mucolytic like Mucinex. Sometimes not as helpful by itself. So if you have a cold, you don't run to get Benadryl, is basically what I'm saying. You want to get something that's going to break up the mucus to help you to get it out faster, like I said, like a Mucinex, something like that. And then of course there are prescribed medications, but I will leave that to the point when you go into the doctor, that they prescribe what they feel is going to be helpful for you. Now, some things that I did want to really touch on that may not be as beneficial for you, um, are some, basically, like I mentioned in the start of this, was antibiotics. Now, again, because these symptoms are caused by viruses, antibiotics are not going to be helpful because those are targeting bacteria. If this is not a bacterial infection, an antibiotic will not be helpful. Now, that is not to say that your viral infection left untreated or left unchecked cannot grow and cause bacterial overgrowth over time. That absolutely can happen. And for some people, like for instance, in the case of a sinus infection, after a certain period of time, with that mucus just sitting in the sinuses, over time you can have an overgrowth of bacteria, and it can in essence become a bacterial sinusitis. But when you just started having symptoms, likely that's a viral infection. Okay, so using an antibiotic is not typically helpful. Now, for the common cold or like a common upper respiratory infection that we're talking about, oftentimes antiviral therapies are not helpful. Now, I know you're probably thinking, okay, didn't you just say an antibiotic isn't going to help? No, it's not. But an antiviral is not necessarily going to help either, because they're targeting very specific things, and antivirals are made to target specific things within certain types of viruses. So for instance, if you have the flu virus, one of the medications that we use is a antiviral medicine that targets the flu virus specifically. So that medicine would not necessarily work for a common upper respiratory infection like a cold, because the virus that is causing your cold is not the same virus as what causes the flu. And I hope that makes sense for you guys. So I know sometimes you come into the office and you're like, I have this cold, it's hard to shake, I'm really annoyed, and I want some medicine. And the doctor tells you, well, there's not really a good medicine for us to prescribe for you. That's because there is not a medicine on the market that targets the common cold. Usually, for most people, it's what we call self limited, which means it's going to go away in its time. It runs its course. Your immune system kicks in, fights it off, and you get rid of it. Now, for some of you, the cough in a viral infection can linger for 4 to 6 weeks. And I know you don't want to hear that. Because most of the time when I tell patients that in the office, they're like, what? I'm going to have this for that long? No, it doesn't mean you're going to have it for that long. But can it happen for that long? Absolutely. Now, the key is that after you get over the hump of it being bad, usually that cough that lingers should be getting better over time. That's the key. It should be getting better over time. Now, if that cough continues to get worse, or you begin to have shortness of breath or those kind of symptoms, that means that you need to go on ahead and go get evaluated, because either this is moving further down into your respiratory tract and potentially lead into a lower respiratory infection, or something more is going on, which, like I said, over time, sometimes bacteria can overgrow and you develop a bacterial infection, which then does require antibiotics. Okay. So that actually leads me right into the topic that I had during the third week, which was talking about when do you seek medical care? So I mentioned earlier that if you have a fever, you can use ibuprofen or Tylenol to treat that fever. Now, if your fever is not responding to the ibuprofen or Tylenol, assuming for children that you're given the appropriate dose, which you can check with your primary care doctor about what dosage to be given, because usually it's based on the child's weight. So you're given the appropriate dose and there's no response, or for an adult, you're taking two over the counter basically Tylenol or ibuprofen, and you're not having a response. That means that something more may be going on, why that fever is not responding to that medicine. So go on into the office and get that checked out. Okay. If you have sinus symptoms, now you've done the nasal rinses, you've used something like intranasal steroid like Flonase, which is over the counter. You've used those things, and your symptoms after a week or more is still persistent, or they're getting worse, that is the time for you to go get checked out for sinus symptoms. Anything before that is deemed a viral infection, unless it's so severe that you have facial swelling or other symptoms associated with it. So I know that some people, they wake up in the morning and they feel like, oh my God, my sinuses are clogged. Let me run to the doctor. Let me run to the urgent care. Let me go get an antibiotic before this gets worse. No, what you should do is run to your medicine cabinet and do a nasal rinse. Okay? Because likely that one day, or not even a full day of symptoms, is not a viral infection. It's not a bacterial infection. It's absolutely viral. Um, and I know that's not the popular thing to say, and it's not what people want to hear, but it's the truth. Okay. So if your symptoms are getting worse in spite of all the home remedies that I mentioned before, that's absolutely a reason to go get it checked out, because other things can be going on, such as the flu, such as COVID. And even though we don't want to acknowledge it, the flu and COVID is still killing people every single year and every single season. And so those are reasons that you absolutely need to go get it checked out if your symptoms are not improving when you're trying home remedies. But when you come into the office after a day or two of symptoms, and you haven't tried anything, you know, we'll still go ahead and do the testing for COVID and flu just to be sure. But a lot of times, unless you have the bucket list of symptoms that goes along with those illnesses, and it's just upper respiratory, it's more likely that it is just a upper respiratory virus. Okay. Now, if you begin to have difficulty breathing or shortness of breath at any point, that is a reason that you need to be seen, regardless of what it is, because now we're talking about something going on with your lungs. So that would be a lower respiratory infection. You need to go on ahead and get that evaluated. Okay. Now there's certain classes of people that also should be getting seen sooner, which are people who have a history of asthma. So, anyone with a history of chronic lung illness. So, asthma, those who are smokers, those who may have COPD, whether it be related to the smoking or not, you need to go on ahead and get checked out. Okay. So those are the categories. Those are a couple of the categories of people that I would say go on ahead and get evaluated sooner than later. Now, I know I've been talking a lot about all of this stuff, but it's so much information and it's such a broad topic that I wanted to go ahead and start answering some questions for you guys. So if you have any questions, go ahead and put them in the comments. I'll be happy to answer. And I'm going to go ahead and do a quick social media check to see if I'm missing any questions on any of the social media platforms. And I'll continue on. So for now, I don't see that I have any new questions on any of the social media platforms, but I will continue to check. So if you're unable to send me a message on the comments on YouTube Live, I am going to be checking on other social media platforms. So that is TikTok, Facebook, that is Instagram. So for anyone that have questions about any of those things, be sure to message me, or basically direct message me in one of those platforms. And it does not look like anyone has sent any message there either. And also, if you know me personally, you can send me a text message. Okay. So hi there. It looks like we do have a question. It says, if my symptoms go away and return after a few days, what should I do? Okay, so it actually depends on what symptoms you're referring to. So, and I'll break it down like this. If you have a cold and your cold goes away and then it comes back, I would first say, do you have children in your home? Because they like to share germs. They don't like to share a lot, but they share germs a lot. Okay. So if you have children, you may just have been reinfected. And that happens commonly during this kind of season. So if you, let's say that you also had this upper respiratory infection, you had a cold, and you were coughing and sneezing and you're all over your house, you're in your bed sheets and you doing all of this, and then you get better, but you didn't clean up. Guess what? Those germs are waiting for you to reinfect you. And that's probably what happened. So I would just say that be careful about that. Now, if you have sinus symptoms, so this is why I said it does make a difference on what the specific infection is. If you are having sinus symptoms and your sinus symptoms go away, like, and in a day or so, they're back and potentially worse, I would become concerned that there may be a bacterial infection that has formed. And in that situation, you absolutely do need to go get evaluated. Okay. So if your symptoms go away in the setting of a sinus infection and then it pops right back up, I would go on ahead and get that evaluated. Now, do you feel like your symptoms went away and it came back? It's not as bad. Your immune system is still fighting it. If it's a cold, like I said, it's possible that you just got reinfected. And so you don't necessarily have to get seen. But all the other things that I said before still stands. If you do home remedies and they don't do anything for you, you can absolutely go on ahead, check in with your primary care doctor or your pediatrician, or come on into the urgent care and we'll evaluate you. Okay, I hope that I was able to answer that question for you. Do you guys have any other questions? Feel free to pop them into the chat. comment below or send me a message via one of the social media platforms. I will continue to check those and see whether or not you guys have any questions there. In the meantime, I'm going to say this too, that for most people, and I come across this a lot, where people do ask like, well, I am using this particular oil, or I'm using this particular type of remedy, and this is what works for me. This is what my mom from the Caribbean used. This is what my Chinese grandma used, and these things work. So we call those, what we call them, anecdotal. So in essence, they probably do work for you, and if it works for you, I'm not going to knock it. But what I like I mentioned before, that's not my area of expertise. But what I can speak on are things that have been evaluated in the literature, which basically means studies have been done on the things that I'm talking about. Okay, so a lot of these herbal remedies, there's not been a lot of studies done on them, so I can't really speak on them from a scientific perspective. Now, for someone who has done research on it, maybe they can do a better job at that, but I like to stick to where my expertise is. Okay, so any additional questions for me, go ahead, pop them into the chat, and I will be happy to answer them for you. And then I am gonna bring up one more herbal remedy that someone asked me about recently, which is why I'm going to bring this one up. And it's about zinc. And so using zinc for the treatment of upper respiratory infections. And zinc, so zinc is actually, there have been studies done on zinc, and it has not been shown to be effective to limit or decrease the duration or the severity of symptoms. So this is one of those things that has minimal or uncertain benefits. So it's not very clear that it's beneficial to take zinc. So therefore, I would not go ahead and say 100% you should be using zinc supplements, because there are reviews that have been done on specific zinc doses that should be done, that could potentially be used to decrease symptom duration, and that would be something that you should talk about with your primary care doctor. However, like I said, the studies have shown that it has not been shown to decrease the duration of symptoms or the severity of your symptoms. So I just wanted to make that clear. Are there other benefits from it? There may be, but there's still ongoing studies about that. Okay. So what questions, I know I've covered a lot thus far. What questions do you guys have? Continue to send them in and I'm happy to answer them. I know sometimes it's difficult and it's frustrating when you're like, oh, I got a cold. One question that comes up, it seems like comes up a lot, is, am I infectious? Doc, am I infectious? Can I spread this to someone else? Absolutely. It's a virus. You call for a sneeze on somebody else, they can get it. You call for a sneeze on your hand and touch the door handle, and somebody else touches it and now touches their nose or eyes, like I mentioned before, they can get it. Does that mean you can't work? Mm-mm. You could still go to work. You know, you just don't want to. You can still go to work. It's just that you want to take precautions. Use the hand sanitizer, wash your hands. If you have a mask, wear your mask. It's just those kind of things. But so are you infectious, so to speak? Yes. Is it so infectious that you cannot work? No. You can still go to work. Okay. Now, if your symptoms are worsening, like I mentioned before, and you are uncertain about what to do, go see your primary care doctor or go get evaluated at an urgent care. That's what I would recommend. So all this conversation, all this that I'm telling you, it's all useful information, but it does not take the place of you seeing your primary doctor or going to get evaluated in person if you are concerned about your symptoms. Do not say, oh, I was listening to Dr. Thorpe and I'm not, I'm just not going to get evaluated. And you're sitting at home with your symptoms getting worse. I didn't tell you to do that. You decided that on your own. Now, if your symptoms are getting worse, go and get evaluated. If you are unsure about what to do, go get evaluated. If you have an infant child, a newborn, an infant, a young baby at home, don't use these tips. Go get them evaluated. Those kids need to be seen in the doctor's office. So they are off limits to this discussion, okay? If you have young children, they need to be seen, they need to be evaluated. This does not apply to them. For older children, teenagers, things like that, absolutely, you can use these tips. But again, if the symptoms are getting worse in any way, or if they have any comorbid conditions, which means any other illnesses like asthma or any other lung disease or cardiac disease, or go get them evaluated. Okay? If you are unsure, this is why I got to keep stressing this. If you are unsure about what to do, this is when you make use of telemedicine. You get on that telemedicine appointment, ask that doctor, do you need to be seen in person, or is it something that can be addressed online? Or if you can't do a telemedicine appointment and you can go in person, go in person. But if you don't know what to do, that's what you should do. Get evaluated. Okay? What questions do you guys have that I can answer for you? I know I've been going on about a lot tonight, and it's just one of these topics that come up so often, especially during this season, that I thought that it was really an important one for us to discuss. Now, if you guys have any other topics that you want me to talk about, be sure to send me either a comment in the messages tonight, or feel free to direct message me on any of the Amize Health social media platforms. I'll be happy to take a look at it. If it's something that is within my scope of practice, I'll absolutely have a conversation about it as I plan for the upcoming year and what topics we're going to be doing. If there are things that you guys want to hear about, let me know. Let me know, because this is for you. This is to educate you. So I will be happy to go through those things that you guys are concerned about, and we can chat about it. Okay. So what additional questions do you guys have about the upper respiratory infections that we've been talking about? I know I've put a lot of information out there for you thus far, and I hope that it's all been helpful. So anything else that you guys have to ask in our last couple minutes together here? Okay, so I'm gonna keep checking social media while I wait for you. And if I see any questions pop up, I'll be sure to go ahead and answer. All right. So I think this has been a good discussion. Even though it kind of, it's primarily me talking, but I do think that it's been a good topic. It's been a good discussion, and I hope that you all really do listen or feel like the pointers that I've given you have been helpful, because sometimes, especially when you are non-medical, it can be hard to make a decision about what to do. And sometimes you're at home and uncertain, when you have a cold and the cold is nagging you and you're like, well, I'm not sure. So these tips, I hope you do really find them helpful. And as you even try the home remedies, trying to decide when you need to go into the doctor, I hope that you use the tips to avoid getting sick. Try out the home remedies that I mentioned, and go ahead. If them symptoms are not getting better, go ahead and get seen. Ultimately, I want you to live your best life and have amazing health. That's really what it comes back to. Living and having amazing quality of life and health. And if I can help in any way, I'm going to continue to do that. Okay. So I'm going to wrap up now. I hope you guys have a wonderful, wonderful week and holiday season. And as we plan for the upcoming month and new year, if you guys have any questions or comments that you want to drop me, please definitely drop them in the comments, send me direct messages. I'm happy to listen to your feedback, and then, grow from there. So drop those comments for me. We'll definitely be chatting again soon on our next Q&A. In the meantime, make sure you follow me on all my social media platforms, because each Monday I drop a new video giving you some tips about a new topic. And every fourth Monday of the month at 8 p.m., that is when we do these Q&As, and you can ask me questions about the topics that I talked about that month. Okay? All right, you guys have a wonderful, wonderful week. Take care until we talk again. Have your amazing health.